I'm Landry Fagan, Vice President of the Board of Health, here filling in for Morgan McMillan. Today is August 12th, 2024, and I'm calling the meeting to order at 5:31 p.m. The first order of business is public comment.
Great. We have 3 members of the public signed up for public comments. The first is Len Siegel. I don't see them online, so if they log on, I will call them next.
Do they have to read the text?
Written comments, no. No, so those are just submitted to the board.
Oh, no, the little display.
Oh, yes, sorry, thank you.
The Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the Board of Health or agency staff, many of whom are top experts in their field, to review that for accuracy or grounding in scientific evidence or provide a response to public comment at Board of Health meetings. Opinions expressed by the public should not necessarily be interpreted as accurate if staff and the board does not challenge this perspective.
All right, so we'll move on. Let's see, we have Rosa Aguilera. I will make you a presenter and your 3 minutes will start whenever you're ready. Let me get my timer up.
Hello, can you hear me?
Yes.
Hi.
Perfect, go ahead.
Yeah, sorry, my legal name is Rosa Fuster Aguilera, but here it shows my preferred name. Thanks for your time. I'm here to implore you to demand a ceasefire on Gaza. And this is because of the latest ICJ ruling. I do believe that the U.S. is complicit with the state of Israel, illegally occupying the West Bank and Gaza and committing many war crimes. I just want to mention that there's this Boulder County Policy 1.6 that was introduced in 2020 for a fully inclusive anti-racist and multicultural organization. And I quote, it says a Boulder County where humbly works with larger communities, regional, national, global, to eliminate all forms of oppression and assist in creating fully inclusive anti-racist and multicultural organizations everywhere. Well, if you claim this, then you will understand that not demanding a ceasefire, it is in misalignment with this policy. So, for example, there is a polio outbreak of type 2, which had been declared eradicated in September 2015. There is this polio outbreak of type 2 in Gaza right now. There's multiple skin diseases that are propagating due to the polluted water and lack of hygienic conditions, or waste disposal in Gaza. 99% of the world's CO2 emissions came from the first 60 days of the Israel's genocide in Gaza. We are, I believe, in day 310. So you can imagine, right, the amount of pollution that all the bombing and the use of white phosphorus, which is illegal, is producing, not just in Gaza, but this affects us, right? And there is evidence of rape and abuse of Palestinian prisoners. So I think that this is very important that, you all demand a ceasefire, because if you're aligning by this policy, you need to do this. On top of that, I've been aware that Boulder County public health employees have been prohibited to wear keffiyehs, which is a symbol of solidarity with indigenous Palestinian peoples. This is a form of oppression and does not allow showing solidarity. How is this possible? Where is this censoring coming from? And you need to align by this policy that you're saying that we, members of all identity groups, are full participants in decisions that shape the institution for full inclusion of diverse races, cultures, lifestyles, and interests. Thank you.
Thank you. Next, we have Lindsay Loberg. So Lindsay, your 3 minutes will start whenever you're ready.
Thank you. Hello, my name is Lindsay Loberg. Thank you for your time. I'm also joining to encourage the board to join the many municipalities and governing bodies who have supported a ceasefire resolution. We've come here before to talk about the responsibility that public health as a sector has to oppose war and siege, because these are public health crises and they also exacerbate and create more public health crises. We already mentioned, Patty already mentioned the polio outbreak, and we have a responsibility to oppose public health crises happening anywhere. And the fact that any of these public health crises, you all know, happen anywhere in the world mean that they're more of a problem everywhere, including here. So this is the case with the polio outbreak, other infectious diseases like hepatitis, the lack of water, waste disposal, hunger and famine that are associated with apartheid are all things that we have a responsibility to oppose as people interested in the public health of our communities and everywhere. Further, the bombs and weapons manufacturing associated with warfare exacerbate climate change. And we all know we don't have time to create more environmental disasters and to create more difficulty to respond to the public health impacts of climate change and climate change itself. We are out of time for that, and it's really important that we continue to oppose this as a community and as people who are invested in one another's health and in the health of our neighbors and the health of people abroad. Also, I want to echo like the troubling impacts of censorship in our governing bodies, and what a bolstering support it can be at a time when public health, after a long period of not being
30
clear about
seconds.
this, has not been clear about the public health impacts of incarceration and job loss. We need to be clear that as a public health measure, we support people's freedom of speech, and that this invests in our community's welfare because it invests in our ability to support one another and our communities and people abroad. Thank you
That's
for
time.
your time.
That concludes public comments.
Item 2, we're gonna approve the June meeting minutes. Favor. Question.
I move to approve the June 10th, 2024 meeting minutes.
Second.
Meaning the minutes are approved. Third. So item 3, introduction of Stephanie Barron.
Hi, good evening, everyone. I'm Indira Gujral. I'm the Deputy Director for Boulder County Public Health. I use she, her pronouns, and I'm filling in for Executive Director Lexi Nolan, who's not with us today. I am very pleased and very excited to announce that Stephanie Farron has joined our team as of July 1st of this year. Stephanie's name may seem very familiar to you. And that is because she was the Director of Health Services at the Boulder Valley School District, where she served in various roles over the last 10 years. Stephanie is a nurse, has a master's in nursing and public health also, and has been in the public health community for probably over 20 years in terms of her work with the school district, her work with Jefferson County Public Health. We have worked with her very closely on immunizations. And she also started off in the LA Public Health Department, and where she did a lot of work on HIV prevention and harm reduction. So We're excited to have her here. And some of you know that she led the COVID pandemic at BVSD over the last few years and was considered COVID. But and her partnership with us was incredibly valuable for having really successful outcomes in our community. And so just super grateful that Stephanie has joined our team. And Stephanie, do you want to share a little bit about yourself? And she's an equestrian. She loves horses.
She can't tell the time.
Well, some clocks are not working.
Oh, look at, there's a picture. I think you hit, just about everything. Really thrilled to be here. Like Indira said, I've been with BVSD for the past 10 years, almost 11 years, I believe. And it was a remarkable experience and really nice for me to kind of get out of public health and work on the other side for a while and actually have to implement and take recommendations and then make them, doable in the real world. And so I think that I'm hoping that that experience will translate back here, and I'll be able to really help the CDM division and public health overall. I'm very excited to be.
Thank you. Thanks. And I think it's also just one more thing that having a nurse leader at the senior level is a really nice addition to complement management teams.
I always have Band-Aids.
Stephanie, this is Google.
Yes.
It's been a learning
I
curve.
couldn't tell the time.
So welcome.
Thank you.
So item 4.
Yeah, so it's Indira again, and I'm just going to spend a little bit of time on the 24-26 roadmap proposal that we have that we shared with you, I think, as part of your board packet. I'm just going to go over it pretty quickly and then see if there's any questions or suggestions at the end. Does that sound good? Okay. Next slide, please. Thank you. So the last iteration of the roadmap was between 2023 and 2022 and 2023. And it was really to help start the agency getting out of the COVID response and kind of bringing the agency right size and bringing us back to kind of everyday operations. And it was really important that we did this. And I just want to give a shout out to Lexi, who not only saw the vision and the need to do this, but then helped to really make sure that it was implemented over that 2-year period. So what that roadmap did was helped us to figure out how are we going to prioritize our work. And this was pre-strategic planning work. It also helped us figure out we have some serious infrastructure needs. So that initiated and kicked off the refresh process, which was all those process improvements. I think 9 huge systems got process improvements done. It helped us figure out that we had serious capacity needs, particularly in the administrative and finance areas where we needed to rebuild the teams. And then always we want to focus on our people. We had pay equity issues. I think we corrected over 50 or 60 different salaries because of pay inequities. We heard from the teams that they needed us to increase communication. So we launched all these increases in the comms team, launched the monthly refresh newsletter, really highlighting each other's work. And then lastly, we always want to keep our eye on culture. And so the agency culture helped us develop some commitments and management team agreements. So this initial roadmap was pretty much a heavy lift, but we got a lot done. And in between that and this roadmap, which I'm going to share, we can move to the next slide. We did the community, the SIB team did the community health assessment. They did the public health improvement plan. We have done the strategic plan, which you were, it's almost ready to go. Yes, next month.
It's being beautified.
Yes, it's being beautified. And that was a lot of work to do that. So the thing, one slide back, sorry, Delia. You're good. So the one thing that we're focusing on in 2024 to 2026 is really getting a little bit more streamlined. So this is really a streamlined version of the roadmap, which is really internally operationally focused. It's not going to duplicate what you see in the strategic plan. It's actually going to be what are the backbone things that are happening that we need to take care of over the next 2 years. And some of it might feed into the strategic plan, and I'm going to talk about that in a second. But this is meant to be a lot more focused. And we have 4 priority areas, and our goal is to try to get these done over the next 2 years. And these 4 priority areas were identified, and I don't want to call them priority areas. I'm going to call them focus areas. These 4 focus areas were identified by the management team as areas where we needed to make improvements. So I'm just going to quickly run through them, and then we'll start with questions. Okay, so the first focus area, next slide, Sally, please. Thank you. Is the continuance of being strategic with our budget and our resources. And this is priority-based budgeting, which I believe we've shared in the past. This was launched by the county as an initiative. And the goal of this is really a methodology to align resources with program and agency priorities. So really taking a closer look at what our funds are and where are we putting the resources, and also helps us to identify where we have gaps. The second area is, as part of this priority-based budgeting, we started to really dive into our budgets, and we have identified that we have some system improvements that we'd like to take a closer look at. And we have worked with some of you on the board about looking at financial internal controls and really systems improvements, which is not just going to help us as an agency, but help all of the programs and staff to navigate the financial systems that we have, which sometimes don't talk to each other. And so that is also a challenge. And it makes it really hard on the admin and finance team when we're trying to do things like projecting. The third one is space optimization. This is something that county has started. The fact that we have went from being in person almost every day to then being remote every day. And now we're in this hybrid environment means that space is becoming kind of a challenge in terms of, are we optimizing the space or not? So we'll be working on this. And I just want to say that I want to give a shout out to Desiree, who's been working on the process improvements of the financial internal controls, and Jordan Bullard, who's been doing the space optimization. Next slide. I might need an extra 5 minutes. Okay. For focus 2, it is really focused on our sources of revenue and our workforce capacity. So I'm just going to quickly highlight on this one that we have been working with other departments within the county to increase our Medicaid reimbursement. Desiree and I have been working with those partners to make sure that we can find a contractor who's going to help us maximize our Medicaid reimbursement. And that really helps a lot of our programs who are really eligible, but not necessarily receiving that funding. So that helps us with increasing our sources of revenue. The other piece is that as we've gone through the priority-based budgeting, we have definitely been seeing that in order to be successful with a lot of the work that we want to do in the future, that we're missing some key positions. And so we'll be focusing on some critical positions to accomplish our goals over the next few years. And then over the past few years, the Public Health Wins survey, there's other surveys have shown that public health staff have left public health in droves. This is a byproduct of the COVID pandemic. This is also, we see demographic shifts in Colorado where our workforce is starting to age out and into retirement. And so as a result, we've joined the state and some other local public health agencies to establish these academic center relationships for graduate and undergraduate students, which will allow us to create that workforce pipeline over the next few years, because they are the future and we need to mentor them and give them the opportunity to have experiences. Focus area 3, next slide, thank you, Dahlia, is about agency culture. So I think it was Peter Drucker, who was the old school organizational psychologist, who said that culture eats strategy for breakfast. And that's very true, right? If we don't have a really strong agency culture, we can have all the strategies in the world, but the people have to want to go along and feel confident in the work that we're doing. And so this area focuses on implementing our workload plan that we developed last year with some supervisors and the supervisor team, strengthening the accountability and part of the teams. And that means not just having key performance indicators for our strategic priorities, but also starting to bring those down to the program level so that we can demonstrate accountability of the resources that we have. And then one piece is we're really trying to push the advancement of health and racial equity through internal capacity development, but also having leaders at all levels, particularly at every divisional level, really take ownership of what that means and how it will be applied over the next few years. And that includes also, we're entertaining the idea of management teams starting to work on the roots of health and equities course as a group so that we can bring solidarity and learning, cross collaborative learning with each other. And then the last piece is we've been working on transparency of roles and responsibilities. This is something I've been working on with Jordan and Patrick, and I do want to give Patrick a shout out because he really helped to put this this whole roadmap together. And then the last focus area, next slide, please, is just around county collaboration. There's a lot of county collaboration that happens with participants from our agency. And we just want to create a better system of transparency about what is happening and just kind of more regular internal system updates. So in the roadmap, what you see is a RACI chart. It spells out who's responsible, who's accountable, where are areas where people need to be informed. And our goal is then to build an implementation plan out after that. So that's it. And I'm open to see if there's any questions or concerns.
I have a request again, or a repeated request. I know we're going to talk about the new format for our meetings, but I know that the priority-based budgeting has been mentioned several times, but I would still like to see more detail on that in one of our budget meetings. To just bring that up.
That sounds good.
And then I had along the same lines of budgeting, the critical positions. I know that in a subcommittee meeting, we had discussed that several months ago. Will we see the cost of the new positions in the 2024 budget update, or will we see them in the 2025 budget?
I would have to defer to Desiree and see what Desiree's
or maybe that
initial thoughts.
So it will be, those positions will be filled in 2024. So we could include that in the 2024.
They will be filled this year.
Yes. Yeah, the plan is to fill those positions this year, and then they'll be included in the 2025 budget as well. Okay. Yeah.
Hey, Indira, this is Lindy. Can I ask a couple of questions?
Absolutely.
Thank you. First of all, I'm excited that the team is taking this on. I think the areas you have identified as priorities are critical from my vantage point, and I'm excited that you guys are putting some organization around this and clarity and transparency to the board as well. So thank you for that. On the revenue side, I may have missed it. I saw the Medicaid reimbursement piece, but can you clarify the focus on grant funding and how that fits into the revenue picture? I may have just missed it on the slide.
Well, we always have a focus on grant funding, given that our budget is 2/3 grant funded. And so we do have a grant writer who we have contracted with. And so that grant writer has actually helped us bring a lot of money in the harm reduction and prevention space, in the mental and behavioral health space. And so we have kept them on contract because they have been incredibly helpful in helping to generate that revenue. In terms of the Medicaid revenue that we had prior to COVID was pretty stable, but during COVID, a lot of the systems and a lot of people left. And so Medicaid's just really hard to bill for, and it's very complex. And sometimes it requires you to have a electronic medical system, which we don't have. And so some people are having to hand enter into the system, into Medicaid, and sometimes they get accepted, sometimes it doesn't, and it's a lot of work. So what we're trying to do as a county is partner with community services and human services to figure out how do we maximize this Medicaid revenue without it requiring like 7 people to do it. And how do we work with someone like a third party who might be able to help us maximize that money? And so some of the systems that we've talked to, they charge only 9% for every Medicaid dollar that you bring back, which is pretty amazing. It's kind of a low cost, and it doesn't require our staff to have the capacity and capability just to be focused on that. So those are the kinds of things that we're looking at to increase the revenue.
Okay, that's helpful. I guess on the grant side, I guess what I'm trying, and Dara, maybe a more pointed question is, are you guys looking at increasing the percentage of the budget that may be coming from grant funded sources?
That's a good question. And, I think I'd have to take a historic look at what percentage of the budget has come from grant funded sources to see if it's always been around 66%. So that's something that we can do a little bit of inquiry and get back to you on, if that works.
Yeah, that's great. I would just like to understand the longer term strategy there. And if we're thinking that that's too overweighted to grant funding, if we want to actually put more energy towards grant funding, et cetera. So I'd appreciate that. And I'm sure that'll also come up in the budget strategy conversations as well. But having more visibility into what the staff is thinking would be really helpful from my perspective. And then the second question I had is on culture. So that's a very nebulous term. How are you guys how are you thinking about defining what the culture specifically is for public health?
Well, a lot of our culture is really aligned with our core values that we have identified. And then also over the past few years, we've developed agency commitments that kind of say this is what we agree to as an agency, and that is in alignment with the work that we do. And those also help to define what our culture looks like. I think where we have had challenges on the culture side is workload. And that showed its head during COVID, where we had a lot of burnout. We had a lot of people who had to leave because of their, personal health being impacted. And so what we focused on over the last year was building kind of a hybrid-based culture. When do you come in and meet in the office for like collaboration, for example, versus when are we working from home? And how do we create a new kind of culture of this hybrid environment? And one of the things that Jordan Thomas presented at the last supervisor meeting, for example, was, and Jordan's like, what did I do? Was how to use technology to create like Viva Insights in the Microsoft. How to use that technology for you to create a block in your day where you're not meeting all the time and you're not being overridden by meetings. And so it's how we work together is the culture component, and how we align our values to the way we work. And then I see Kelly's hand up about the grants, but go ahead, Lindsay, too. First.
Yeah, I think I would appreciate it, Indira. I'd like to offline on this topic with you and me and Amber and Lexi. I think there's more to talk about here. We have some external perspectives, so I'll just leave it at that. But if we could, I understand those are enablers of culture, but that's not really what culture is fundamentally. And so I think I'd like to understand more what the actual culture of the organization aspires to be. And how that aligns with external stakeholders as well. So let's have more conversation on that topic, if you don't mind.
That sounds great. Yeah, and 2 minutes left. Kelly has a comment. Kelly, did you want to?
Yeah, just two comments really quick. So with regards to the budget, to the grants piece, I mean, so the roadmap and the strategic plan sort of run side by side. It's like with my family, it's rice, you better have beans, right? And so this is the same sort of thing that happens, I feel, with the strategic plan and the roadmap. Because in the strategic plan, we do talk about how do we streamline systems in order to have better approaches to what grants we go after, how we make those decisions, how do we facilitate those processes so it's not as onerous on staff who want to apply for grants. And again, looking at those systems of, is it worth going after a $10,000 grant, for example, versus waiting and putting more effort into something that's $1 million or $500,000 or whatever. So that a part of the grant space is important, that it's also flowing into strategic plan in the STS priority. And the same with culture. I think part of this in culture is that strategic plan has a fairly robust monitoring, evaluation, and learning piece. And part of that will include yearly staff surveys, and which will allow us in order to, because part of this isn't just switching from here until tomorrow we got something different. This is a process, I feel, that will lead us to the place where we want to be. But like any journey, right, this is not something we jump from point A to point B necessarily. There's a lot of point A, point one, A, point two, and things like that in between. And that's why I feel some of this process is going to get us to the place where we want.
Yeah, Kelly, I just think we'll need a more direct response to what our actual strategies in terms of percentage of funding or revenue that we anticipate would come from grants versus otherwise. And I think, obviously there's been a lot of discussion around that with the county commissioners this year. And I think we need to, I think, be clear about what our expectations are, right? And what we're doing as staff to think about that revenue source, wherever it's coming from. So, but I appreciate what you're saying, and you're right, they go hand in glove. You can't do one without the other. So appreciate that. But I will want to get more specific on that question over time and when you guys are ready to talk about it.
Any other questions? All good?
Well, thank you. Item 5 is the budget update.
Perfect. I'll be picking this up. You can go ahead and go to the next slide. Thank you, Dahlia. So this is Sam is coming on, correct?
Good
So
evening,
Sam,
everybody.
Yep, Sam Hoage is our auditor from Clifton Larson Allen, and so he's joining us today, and he's going to give us an information on the 2023 audit. Go ahead, Sam.
Thank you, Desiree. If we want to go to the next page, just for the quick agenda. First of all, thank you for having me. I'm happy to present the results of the 2023 audit over Boulder County Public Health. We'll go into the scope of the engagements, as well as our responsibilities, as well as management's responsibilities for the audit. We'll go into a little bit of a presentation of the financial statements, really some key highlights there, as well as the audit results and the required communications. So any questions, feel free to chime in at any moment. Otherwise, if we want to go to the next slide. So our responsibilities are for expressing an opinion, and really the opinions over the financial statements. And what are those financial statements? What are those comprised? I don't have those pages within this slide deck, but the audited financial statements were provided to Boulder County Public Health. And within our opinion pages, starting on page 1, it really kicks it off with what our opinions cover, including the governmental activities and the main fund, the general fund over Boulder County Public Health. We do present comparative financial statements. So this is as of December 31st, 2023 and 2022. And the good news is that in our opinion, the financial statements referred to right there were presented fairly in all material respects. So in other words, that's an unmodified or a good opinion. So what's what everyone wants at the end of the day with an audit. So the next paragraph within our opinion goes into the basis for our opinions and what those standards cover. So as it says over in the left-hand side here of this slide, is that they were in accordance with U.S. generally accepted auditing standards and government audit standards. So what that really means is for government auditing standards is that's really triggered with the federal funds. So I know we just spent a little bit of time discussing the grant operations of Boulder County Public Health and the importance of those grants to the organization. And really what government auditing standards covers is just a little bit more in-depth work that is covered with the single audit that's covered at the county-wide level. But our responsibility, of course, is to audit those revenues and expenses of grant funds during the course of our engagement. So what the audit does is does not relieve management of its responsibilities for choosing what the accounting policies of the entity are, as well as determining what the internal controls and policies are of Boulder County Public Health. We also do not opine over internal controls, meaning we don't provide an opinion. At the very end, in accordance with government auditing standards, and really at the end of our various pages is to provide that report over internal controls that provides more information and context over the internal control work that we do, whether it be risk assessment based in our audit procedures and evaluating those tests of design over certain key internal controls, but we do not provide an opinion due to just limited test work as a part of an audit standard. So if you want to go to the next page, this almost is like a table of contents, this slide for the financial statements. And this opinion is pages 1 through 4. As I look at the table of contents, it covers the various aspects of the financial statements, include what makes up those basic financial statements. Management's discussion and analysis are the next pages within the financial statements that you'll get to. And that covers a 3-year period. So because we have comparative financial statements, 2023 and 2022, the MD&A will cover 23, 22, and 2021. So that's some good reading there for getting information about those 3 years and really just a trending of how Boulder County Public Health has gone from 21 to 23. I pointed out the difference between the statements of net position there and the statement of activities compared to the balance sheets and the statement of revenues, expenditures, and changes in fund balance. The difference between those two line items is one would be what comprises the government-wide activities, which is the full accrual. It's the economic resources focused. It includes any debt. It includes long-term assets, really the full picture of Boulder County Public Health, including the pension and OPEB liabilities as well. The balance sheet and the statement of revenues is that general fund focus. So it's the current focus with really liquid assets and liquid liabilities. So it's excluding those long-term items that I had just mentioned. The difference, if you look at those in the financial statements, really with government-wide, if you go to the very bottom of those statements of activities and statements of net position, is that you'll see a negative ending net position. And that's really driven by the inclusion of the OPEB and the pension liabilities. Those are excluded liabilities from the balance sheet. So if you want to look at it from more, how are we doing operationally from a general fund perspective, you look at the balance sheet and the statement of revenues, and you'll see a positive change in operations year over year, 2023 and 2022, as well as a healthy ending fund balance. If you also want a breakdown of the fund balance based on restricted funds, assigned funds, and unrestricted funds, that's where the balance sheet will show you further information. And finally, within the basic financial statements are the notes to the financial statements. So that covers the bulk of that financial reporting document. Nothing really of note here from a change year over year. Most of those notes include very lengthy disclosures over the pension and OPEB work that we do and prepare in the financial statements. But in total, everything from the statements of net position down to the notes to the financial statements is what comprises our audit over the basic financial statements. The last two bullets include the required supplementary information. The table of contents does a good job of listing out what comprises the RSI. MD&A, for example, is included in that, and what the difference is between required supplementary information and the other supplementary information is that we do not provide an opinion over the required supplementary information, but we do over the supplementary information. And the reason for that is simply different audit procedures that are required as part of our supplementary information, but don't give us the same information with the required or RSI. Any questions over this? I know I went through that in pretty high level, but any questions before I proceed? If none, we can go to the next page and get into some more of the governance communication. So the other final report that we issued was the final governance communication, and this lists out really the significant communications that we are required as auditors to provide at the conclusion of an engagement. So the first piece of that is going into accounting policies, noting where in the financial statements those are disclosed. So that would be within the notes to the financial statement, those several pages within the notes. The accounting estimates also would provide any significant management estimates if those were really deemed of a higher risk nature. Accounting standards did change a little bit this year, applicable to 2023 audits, and those require us to communicate if anything was of higher risk, if we had to do additional work over accounting estimates. So in both cases with accounting policies and accounting estimates, there were no changes or nothing significant to communicate. We go to the next page. We also had a clean sheet here, if you will, in terms of no difficulties encountered in performing the audit, no uncorrected or corrected misstatements, and no disagreements with management. The difference between an uncorrected and a corrected misstatement, sometimes there's an issue that we identify or an adjustment that could be posted, but it's immaterial enough to the financial statements that we don't have to post it as an audit adjustment. So that's what an uncorrected misstatement would be. I just wanted to provide a little clarity there. At the end of the day, didn't have either situation arise. So job well done. And I think one last page, if you go forward, is that within that governance communication, there were also management representations that were signed by management. We identified no communications or consultations with other independent accountants during the course of the audit, and no significant issues that needed to be discussed with management prior to the engagement. Next page. That would be the end of my presentation. Wanted to just echo thank you to Desiree, Jessica, the entire team, anyone who's involved with assisting us throughout this timetable. I know we started really in May, so this is the culmination of all of that hard work. Very happy to constantly move up our issuance date and our target. So I know we continue to work very hard as a group to collectively meet that goal. And again, just thank you for all the time and effort. Any questions at this time?
Thank you.
I just wanted to really reiterate what a great job Desiree, Jessica, Jerry, Anae, Lisa, Kenda probably helped out. like,
Carol,
Carol. And all of the work that they did this past spring. If you remember, they had to take all the allocations and reallocate them to PH 11, 12, and 13. That was a tremendous amount of work, and it probably influenced these audit results being so clean. So,
Thank you, Sam. Appreciate you coming on.
If nothing else, have a great evening and feel free to reach out to me with any, I think on the next page is my contact information, so feel free to reach out. Thank you.
Thank you.
Thank you so much. Oh, wait, can I say
Yes, of
one
course.
thing for that?
Yes.
I just wanted, since we're going into our budget study session next month. So just to let the board know and to reiterate, we had discussed what we would like to see for the going to be prepared for the budget subcommittee. And just, we would like to see that detailed Excel sheet that you had shown Morgan and I in the subcommittee meeting with the 2024 and 2025. So it's all in one place. We also want to see the revenue added as well, so we can see the revenue to date for 2024. And then we would also like to see reserves shown, pulled out and shown separately as well, so we can see how much we're planning to use for 2024, the projections of use for 2025, and then if there is an initial plan for rebuilding our reserves. That's it, just to make sure, because what we don't want are the little tiny snapshots that we can't put together.
Yeah,
So
right.
just that big sheet where we can see all the summary at the top and then see, expand it to see all the details below.
I will be giving you an update on a couple of those items, I think, on the next slide. So these are some of the things that you were just touching on. So for our 2024 amended budget, that we have put behind our 2025 budget because we had an August 2nd date that we had to get that to the county this year instead of our September 1st date, which was the historic date. So that got moved up a month on us. So we have pulled that information together, at least the initial amounts. These are not the final amounts, but we have an initial budget ready to go. We're just adding some narratives. So that is going to be going up to the county. In the 2025 budget, we have a base budget amount, and then we have some proposals that we're including. So we'll go over that more in detail in the budget study session. For the 2024 amount, we'll be editing some of those initial amounts. The 2024 budget was largely still holding that initial county ask in there. So we need to go back through and do some edits and edit out some of those funds, make that more realistic to what our actual budget is for 2024, and make sure the systems are reflecting that as well. And we have gone through the process of talking to Clifton Larson Allen. We just spoke with Sam. Sam's group will not be involved in some of this work that we're doing, but we're doing some of this internal review work that is being done through another group with Clifton Larson Allen. Part of what they had to do when looking at our scope of work is make sure that nothing was going to compromise their impartiality in our audit. So we have received a scope of work. We have a contract that we've looked over that looks good. There was an additional ask to do a workforce study. That will be coming on a separate contract because that's a separate subgroup within the consulting firm. So that'll be a little delayed. The initial scope of work, though, is going through our contracts department, and they're ready to send it over. So we're just finalizing that piece. The revenue reporting that you were just mentioning, Brooke, I was able to get the county to build us a revenue report. I did some sleuthing around and found some existing reporting that another department was using. So we were able to take that and edit it to make it our own. So we now have a revenue report, and we have the quarterly report or a monthly budget to actual report. So we can share all of that information with you at our budget retreat. Right now, one of the areas that I know is a focus is looking at the reserve and how do we predict what our reserve rollover will be at the end of the year. What we have right now is two different figures. One is a point of time if we were to spend down all of the monies that we anticipate what it would look like at the end of the year, which we know isn't realistic because that doesn't always happen exactly like we think it will. Things change as the year goes on. The other place where we have that reserve amount is in that monthly amount where we can see what that monthly month over month amount is rolling over, which is a snapshot on an ongoing basis, but doesn't project out to the end of the year. We were successful in offering a senior budget analyst position. So that person will be starting with us on September 3rd. So hoping to get some more forecasting built into our budget, which is really what I feel the ask is, to be able to project, forecast, and to have a more realistic expectation of what our grant spend downs are going to be by the end of the year. I think those are all of my items. Do you all have any questions? Mandy, do you have any questions?
Nope, no questions.
All right, that's the end of my updates. So good luck.
Busy.
Busy. Budget study session is on the 21st of August, so thank you. That's coming up.
Item 6.
I think this is Jordan. Yep. All right. Good afternoon, everyone. Jordan Thomas, Business Operations Manager, Board of Health Liaison, she, her pronouns. Tonight we wanted to submit a couple proposals. They're in progress. Drafts. Want to get your initial feedback on shifting some of our Board of Health meetings, shifting the focus of them, and also finding ways to have the board be more connected to these programs if we were to make some of these shifts. So next slide, please. So BCPH leadership and Board of Health, specifically Morgan and Lexi, have been having conversations on we need something. We need to start to revamp these Board of Health meetings to help the board stay up to date on the budget, to create space for this more strategic planning, create regular rhythms for work plan updates related to the strategic plan, to the roadmap, to different program goals, and also ensuring that you feel connected to the staff Maybe exploring your own interests or your focus areas more deeply, optimizing the use of all of our time. So the staff put in, 2 weeks worth of work into the director's report. My staff, my team, my staff, we always are in Board of Health mode, and you have full-time jobs as well. So taking capacity needs for everyone involved. We presented this proposal to the supervisors last week. It went over pretty well. I think the staff do want to change, but they want clear guidelines. Like, what does this actually mean for me as a supervisor? What does it mean for me as a staff member? And so we'll be presenting the proposals tonight and then ask for formal approval next month, so at the September Board of Health meeting. And if that is accepted, then we would start these transitions in October of this year. So next slide. So the first proposal is shifting our actual focuses of our Board of Health meetings. Let me make it bigger on my screen. So the first month of every quarter, I think it's easier to think about it in quarters. The first one would be budget and agency vision. So this would be a 1-hour meeting. We would still do public comments, still approve the agendas, but it'll be focused on the quarterly budget reviews and agency planning. This can be hybrid. We can choose to make this fully virtual. It would only be the directors' teams and my team are required to attend. So a very focused group, staff, people can still attend virtually, but the people in the room, very focused. The director's report would be in alignment with our county commissioner quarterly report that we're required to do. So might as well just, feed 2 birds with one hand, and just keep everything very focused on that, giving us dedicated time, reporting back from our budget subcommittee, things of that nature. Month 2 of the quarter would be the strategic plan advancement in emerging areas. Once again, 1-hour meeting, hybrid or virtual. The focus would be not on all of these. We can pick and choose like what makes sense for this month's cadence. The strategic plan, the roadmap, HRE topics, which is health and racial equity, updates on community engagement and policy work. Those in attendance would be directors teams, business operations. If we want to talk about strategic plan, that's the strategic initiatives branch and health planning and evaluation team, and any other highlighted program staff that we decide that would need to attend. The director's report would be more on like those narratives, those summaries, and just overall progress. And this is the one that staff, the supervisors want a little more guidelines on. For this, they may require key staff. Who are those key staff? So highlighting those and actually naming them. And then the last month would be more of what we've been doing for our Board of Health meetings, having these program spotlights and program update, just general conversations. This one would be a little bit longer at those 1.5 hours. We prefer in-person meetings to have those connection points. It would focus on timely issues around BCPH programs, policy, strategy, community updates, and highlights. Those in attendance, directors team, key management team. So if CDM's presenting, then we would like to have our CDM division manager present, and then those highlighted divisional staff. The director's report would focus on programs, program challenges, learning, strategic shifts, and needs. So before I move on to the next slide, any initial thoughts, questions, feedback on this?
I think it's an excellent idea. I appreciate it. Response to what we have all asked for.
Yes.
I think my question is, I do really appreciate the full director's report. So basically month 2 would be the point in the cycle where we would get a director's report like we're used to.
I think so. It would mirror that. I do want it to be more reflective of like the strategic plan. If that's our focus for that meeting, highlighting it and like showing the cross development, the cross team collaboration within the strategic plan. Okay. So I think it would change. Kelly?
Yeah, just as an FYI, that rhythm fits with our quarterly monitoring, evaluation, and learning space for the strategic plan. So it falls right in place when the strategic priorities are providing some updates from that space as well.
One recommendation is to kind of make that director's report in month 2 a little bit hybrid. There's always evolving emergencies, and Carol's with us tonight. She's up. So next, because there are there's always evolving things, but not maybe a full director's report. So that would be my suggestion.
I think that's good. I think that was also brought up at supervisors, like, well, what if something does come up and we want to tell the board about this? Yeah. So yeah, I can If you approve of this, I would go into our director's report and make a couple like reformatting, so it will change drastically of how each program is listed now. So yeah, maybe we can go through a couple iterations. We can check it to see, is this getting at what we need, what the staff need, what the board needs?
And I think also if we move to more reporting, tangible, measurable outcomes, we won't need as detailed a narrative in the director's report anymore. Just something to keep in mind.
I'm presenting and taking notes at the same time, so we captured me. Anything, Lindy?
No, I first thank you, Jordan. This is awesome. When I read it in the packet, I was like, oh, awesome. Well done. Thank you. And I think this really aligns with the priorities of the board, which is really critical. One thing I'm wondering about is what we need to do, maybe it's annually or biannually, in terms of our policies and procedures review as a Board of Health. So I don't know if we want to, if there's other things that need to happen sort of from a procedural perspective, if we need to call that out. But I would like to see our policies and procedures reviewed every year, because I think that we kind of, I don't know if that ever even happened, honestly. But I do think it's critical as a board, we're very clear on what we're governing under. And then also talking through at least once a year what our priorities are as a board, as it relates to the agenda with the organization. So just things to throw out there. I don't know, Jordan, I know what you're trying to get at here, and it's critical, but there's other things that we need to contemplate, I think, in terms of what the board needs to engage around. So just wanted to call that out.
Thank you. Yeah, we can also revisit. I know this year we kind of started those quarterly retreats as well. And so maybe I can include that in this, so we're not losing those board business. I think you as a board, you do have business that you need to attend to. So including that. Okay.
Yeah,
Thank you.
I think the policies were supposed to be part of the retreats. Okay. Did do a policy review, kind of.
But having it more like formalized.
Yeah.
Okay. Thanks, Wendy. Anything else? This is one proposal. There's two. Yes, there's a second one. There's a second one. So this is the shifts in the board meetings. Go ahead and switch to the next slide. So this is a proposal. I believe this was discussed last summer. So we were elevating it back up. So having Board of Health program champions. So if we were to shift all these meetings, your connections with the board, with staff could be reduced because a 1 month meeting would just be with directors, teams, and business operations. So we pulled this list, I believe it was from an email that I sent last year, right before Amber started, of identifying where are your interests as a Board of Health member? Where do you want to do a deep dive? Where do you want to learn more? So we've identified those, we pulled them. So this is still a draft. If you want to wait and to do this next year, we want to see how the Board of Health meetings shift go. We can do that. We can also start integrating these program champions to where being a champion would involve the opportunity for you to meet with teams outside of Board of Health meetings, to take a deeper dive on programs, build those relationships with staff members, and to just overall elevate your position to be to be champions of these priority areas in the community and on the board. So if you approve this in September, I can start drafting out roles, responsibilities, guidelines. What will this look like? This is one thing that the supervisors also wanted to know, like what does this look like? I don't want to add another meeting to the calendars. Thinking about capacity, that was identified as a need to shift these meetings. So any initial thoughts, feedback on this? Do we want to start this or we want to wait until next year? Something.
Yeah, I mean, I like the idea. There is, of course, the time commitment, since this is a voluntary board. And I think that some of us are feeling a bit burned out. And we've also formed subcommittees as well, handle some of these things. But I like the idea, so maybe I would be supportive of starting to draft up what it would look like and then seeing. I think I might want to request to change some of mine.
We want to have 2 board members within each focus area, just so that like if you can't attend this meeting, you have your partner crying.
I think 2 is
like a capacity as well.
And we did,
I had the similar thought
Yes.
as you, because I was like, if I put myself in their shoes.
Yes.
It's a lot. But I do think we could come up with some way, even if it's an annual touch point
Yeah.
on what's happening in those spaces.
Yeah.
So that there are board members who kind of have a better sense, a deeper dive
Yeah.
in those spaces.
We even
Yeah.
thought-
Sorry.
Oh, sorry. We also said, not that you would help make the presentations, but if you wanted to talk with presenters before, like, is there anything that they're missing, anything they want to highlight? So I think we can get pretty creative with what a champion is.
Mhm.
So,
Yeah.
Lindy, sorry about that.
No, sorry. Yeah, well, I like Indira. I like what you just said, and I think I had some conversation with Lexi about this as well, which is as a board member, I'd like to become more informed about how the agency is working and some of the programming. Obviously, we can't, as board members, know all of the things, but this might just be also a plug to the staff in these certain areas that if there's something exciting going on in the community or an event or something where a board member could be invited, I think that also opens the door to say, hey, Lindy, if you're interested, we know you're interested in mental and behavioral health as a topic. There's something coming up here that if you're interested, and it's, I think we need to treat it as very light touch across the board because we also don't want to burden the staff. But I think in my mind, this helps bring us closer together between the board and staff, and also helps us be better champions of the organization when we understand it better.
And Landry, you've started attending the healthcare systems.
I really like those being in those meetings. I think
Right.
It's helpful just to see how public health integrates with all the
Healthcare.
healthcare in the area. I think it's important to kind of.
Yeah.
So the idea of not duplicating and better
Right.
integrating services.
But if we had two board members there,
Mhm.
does it cause?
You can have two.
You can have two.
That's why,
Okay.
we have to sort out at least.
Yeah.
one of the-
Okay, sorry. Because if Amber or Lindy wanted to come or
Yeah.
rotate through, the team could figure out. Okay.
Definitely. I think it's super helpful to be part of some of the other, and maybe there's events in these departments that we can just be invited to, so it's not more work.
Yep.
For everyone, but more just that we can be
Yeah, I like that.
seeing the work of what's happening
Yeah,
as opposed to adding
that's
something
great.
specific for us.
There's some really exciting work happening in the community, so I think it will be good to share.
Yeah.
And
Yeah,
Yeah,
maybe that's like an internal thing. I always read about the events in the director's report, so if I can get on the invite list, then I can do that. Yeah, okay, awesome. Yeah, I can work internally with that. So we can start with that. I'll draft out some more guidelines and whatnot. We can always revisit it. Okay, next slide. So this will be next steps. So like I said, no decisions tonight. Please continue to review the Board of Health packet, the presentation. If you wake up and you have a great idea, please send them to me. Lexi and I are requesting feedback by August 26th. That's a great deadline, but we want to be able to incorporate your feedback into the September 9th Board of Health meeting materials. That's where we will seek formal approval to start making these shifts. And then I will start reforming the director's report, letting staff know, changing the way that we request material from staff. And also your calendar invites may change. They may be fully virtual instead of coming here. So please, take time and we'll make a decision in September.
Thank you so
Of
much.
course. That's all, yeah.
Director's report.
yeah, so I'm going to kick off director's report and then we're going to turn it over to Carol to give us a few updates on, the never ending world of communicable disease.
It might be me.
Oh, okay. It might be you. Okay. Well, first off, I just want to do a big shout out to Jordan Thomas, who has been really integral in keeping the Board of Health updated, organized, prioritized. I know that I appreciate all of what Jordan brings to the agency, and I'm sure you all do too. So thank you, Jordan. So for director's report, there's a couple key things I just wanted to remind you all about. So first of all, big shout out to emergency management, environmental health, communicable disease and emergency management, and the comms team in particular. who handled 2 fires, not just one, but 2 fires that will simultaneously going on, and have done it with ease. And I will tell you that the feedback I hear from others, including the Office of Disaster Management, is that public health kind of sets the bar on how to get things done. And all of those staff should feel incredibly good and proud of the work that they do. The second is just a couple announcements. One is Chris Campbell, who's our emergency management coordinator, has been honored by the county and received a county value award. So it is a individual who embodies the values of inclusion, respect, and support, fostering an inclusive and cultural responsive county government. And it's about stewardship, honoring our past and ensuring that we're thriving for the future. And so it's exciting to see Chris honored that way. He's doing some really great work in emergency management, in the health and racial equity, and really kind of changing the way that we respond to emergencies so we're more inclusive in our approaches.
And that's a peer nominated program. So it's not petitioners, no one from above, it's the peer-to-peer nomination.
And not everybody gets it.
Mhm.
So it's great to see that. Some other exciting news is the All Raise project, which is run out of community health. So this is called To the Root. And this is a storytelling project, which is really dedicated to uncovering the roots causes of substance use among Latina and LGBT youth, who are often not picked up in the data. And I was talking to Allison the other day, and it's Allison and Janice Dicklet who run this program, and it's a federal grant that they have for 5 years. And it's really incredible the work that they're doing, because they're really learning how youth are identifying their needs of like their parents and their like school groups. And so it's very informative work. And so it's exciting to see that they have won the National Association of Counties Award for 2024. I thought this was their 2nd year in a row, but I'm not sure. But it may be, but they are continuing to do the work. It's great. And then lastly, just the community health team received a lot of kudos from the state health department in the Communities That Care project, and that project is in Lafayette, and they have really turned it around. And just a big shout out to the team for really kind of building the infrastructure in Lafayette, and so much so that 100% of their participants in the community in Lafayette agreed that Boulder County Public Health should remain the backbone agency because they are effective in meeting the goals of the group. So just lots of things to be proud of, lots of challenges that we have to face, and super grateful for everybody's work. So I know that we were going to turn it over to Carol or to Stephanie.
I think I'm going to.
Okay.
For you.
All right.
I will need to see the slides.
Okay. Yes. So there were a couple questions about flu, and I think there was a question about the rabies too.
Yeah.
So I got it. All right, Stephanie.
So I believe this is a follow-up to someone had a question at the last board meeting about the HPAI H5N1. Carol Helwig, the program coordinator for communicable disease, put these slides together for us. The slide on the left reflects the number of confirmed cases by state, and that's herds of dairy cattle that have been infected or detected, I should say. And the slide or the graph on the right is looking at the number of confirmed cases in livestock herds within the last 30 days. So through August 12th, there have been 190 dairy herds in 13 states that have been reported. Colorado has the highest number of impacted dairy herds in the United States, and that's since the beginning of this outbreak, which was started in March of 2024. In total, 1/3 of the detections have occurred in Colorado. In the last 30 days, it's basically roughly been almost 80% of impacted dairy herds have been detected in Colorado. There's a number of different reasons why, some folks here think that we might have higher numbers. Some of that being that we're doing a really good job here in Colorado of actually going out and testing and following up. It's likely that other states might not be doing as good of a job. So that, sometimes even though the numbers are high, it can reflect really that we're doing a good job of actually tracking this and keeping an eye on it. The next slide talks a little bit about how bird flu is spreading. We know that it's starting in wild birds and going into poultry and into dairy cattle. It's also been detected in cats, presumably from wild birds, maybe from cows as well, and then from really only right now from cattle and poultry into humans. Virus spillover occurred in Colorado from dairy herds into poultry farms, and they've identified 9 infected poultry workers here in Colorado. There was a large culling of poultry at a farm in Weld County during the recent really high heat, kind of heat dome that we had. And so it's suggested that possibly that high heat event contributed to some of the spreading into humans because of the PPE that folks were using. It was just so hot that they likely weren't wearing it, 100% effectively, right? So antivirals are effective. There's been no human-to-human transmission, and all of the illness so far in humans has been very mild, with predominantly conjunctivitis and some respiratory impacts as well. So again, the transmission of human to human would really make this something very scary for us, and they don't see that as a major concern right now. Pasteurized dairy products do not pose a risk to human health as well. And here in Colorado, they've recently passed some more legislation that all milk has to be tested very regularly, which is another thing that's not necessarily happening in other states. So we're really actually doing a good job there. So there's been a total number of reported human cases, 14 since 2022. There's been 4 from dairy cows since April. 10 following exposure to poultry since April 22, 9 of those being in this year. And the states with reported human cases are Colorado, Michigan, and Texas. CDPHE really is continuing to lead the response, so all communications and everything is coming out through them. They are offering 4-week supplies of PPE to some farms. They're doing this statewide mandatory bulk testing of milk, which I mentioned. And there's a joint CD, PHE, and Department of Ag town hall that was held in May. A lot of educational webinars for households with backyard and hobby poultry that was done in March. And here in Boulder County, we've done some outreach to the Boulder County Fair, which just ended this past weekend. So our communicable disease folks were able to connect with the fair folks and talk through about response, protection, some of the things that they've already set up. We've also have expanded laboratory capacity. We've got respiratory testing kits to promote a local response should we need it. And there is also additional PPE if there needs to be a response at any impacted dairy or poultry operations. And they're continuing to monitor what's happening in the state and have very regular communications with folks at the state as well. So any questions about that? Carol might be available for questions if you have it.
You mentioned there's been outreach for hobby farms. What about around the potential contamination of unpasteurized milk?
That is an excellent question, and I'm not sure if Carol heard that or not. If she does not know the answer to that, I will get that information.
I think there's concern, but go ahead.
Hi,
Oh, good, she's here, yeah.
oh, yeah, I did hear, was it about unpasteurized milk, the question?
Yes.
Yeah, so so there have been communications around potential impacts for hobby farmers. What about for consumption of unpasteurized milk? We know that's a growing
I,
market.
yeah, the unpasteurized milk in Colorado can only be bought through buying a farm share. So you have to own or the cow to do so. And I I don't think that there's been advisories that I'm familiar with, but we can look into it.
I know that that was raised in a policy meeting today because of the legislative efforts from last year. So yeah, we'll definitely be keeping our eye on that. I have a question for you, Carol or Stephanie. I heard that the cases and the surveillance that they're doing is predominantly east of us, but yeah, right next door.
Yeah, it's Weld, and it's not, if you look at the map, it's not all the way out on the eastern border. It's Greeley in that area.
Okay.
Yeah, that's correct. And our jurisdiction does not have very large poultry or dairy operations. Based on like Department of Ag census data, most of the dairy cattle are in on different counties to the northeast of us, mostly.
Hey.
Rabies?
Yes.
There was a question also about the recent rabies case, very unfortunate situation where a litter of puppies was adopted out and they determined that one of the puppies had rabies. It was August 7th, CDPHE was notified that a puppy tested positive. And there were 12 total puppies in that litter. So on the next day, there was a public health order that was implemented to recover all of the puppies. And unfortunately, all of the puppies had to be euthanized. I know, it's very sad.
I saw it on the news.
I know, I did too. And then on the 9th, there was a press release that went out kind of statewide, alerting folks if they had been at this adoption event. The state received about 30 calls, under 30 calls, actually. Carol said that she has gotten a call or two here as well from folks who had been at the adoption event. So CDPHE is working with quite a number of different counties, Adams, Arapahoe, Denver, Douglas, and Jefferson County, really to do this outreach and identify the folks who actually will need post-exposure prophylaxis. So it's actually a really good example, I think, of how, one little puppy can just cross over into multiple jurisdictions. And you really do need to have, a well-trained workforce that can follow up and, make sure that folks are getting the right information and they're doing very good surveillance. So very unfortunate.
What's the time limit for rabies prophylactics from exposure?
It's quick.
It's fast, it's fast, right?
Yeah, I think I'm not sure if Carol's on here or not.
Yeah, it's quick.
Yeah, I think they have.
And it also depends on where your exposure is.
Great.
Yeah.
Right? So it's different if it's like in your exposure is like a bite in your leg versus in like near your head.
Right.
Yeah.
What to do?
Yeah. And it's 100% fatal.
Yep.
Yeah.
Well, except for that one girl who survived many years ago.
I don't remember that, but yeah.
She was given a transfusion.
Oh,
Yeah, it's best.
Because none of the other puppies tested positive, but they can actually harbor it for like 180 days, I believe. So it's, it's hard to tell if they looked developed, not very sad. It's really sad.
Okay, can I ask one more question? On the whooping cough cases?
Yes.
Cases, those are all in high schoolers. Do we know if those high schoolers were vaccinated?
Again, I'm not sure.
Hi.
Oh, yes, I think most.
Yeah, we do see pertussis in vaccinated individuals as well. I can't say of all of our cases what percentage are vaccinated. We could look that up easily, but we do see cases in both vaccinated and unvaccinated folks. And usually when you're vaccinated, there's milder disease and you don't have cough for such a long duration than if you're unvaccinated, we see very prolonged cough or more severe disease.
Yeah, agreed. Just the concern that they're popping up and even in older students. It doesn't bode well. We all know vaccines don't work forever.
Right. And I do know that.
I will say,
Go ahead, Carol.
oh, I was gonna say that the rates that we're seeing right now are similar to pre-pandemic rates. So it's which they were like our baseline. So we're back to our baseline because we did see a huge reduction in pertussis during the pandemic years because the mitigation measures for COVID also reduced pertussis transmission. And now we're just seeing that we've reverted to the baseline. And we do, hope to stay on top of it and not see it surpass that. But we're, keeping all of our systems in place and notifications and tracking everything as closely as we can to prevent it from being a larger endemic this season.
And one quick additional question on the pre-pandemic rate. Are we pretty comparable to other counties in Colorado and pretty comparable to the national rate?
Yeah, Colorado also in general has seen like that reversion to the pre-pandemic pertussis rates. So we're I don't think necessarily higher or lower than the state at this point, but we can look more closely at the quarterly numbers that we have to compare. But the last time I looked at it, we're pretty similar. And then nationally, it's also been just returning, I think, to those baselines as well.
But the baselines are pretty similar.
The pre-pandemic time. Yeah, I would say so.
I mean, there is a seasonality because I remember Carol and Stephanie, there was one year where it was really bad. And then, I mean, it can be bad one year, but then better the next year.
I think 2012, 2013 is the last time we had really bad endemic where, when we see maybe 40 to 60 cases a year, we were seeing like 300 cases a year. And our rate really went up and we did a lot of prevention, but we're not there yet. We're at baseline now.
I'm pretty sure it was 2012 and 2013 because I had my son that year and I wouldn't let anyone come and visit unless they had their pertussis vaccine updated.
There's also been a lot of work since then to improve vaccination rates. Both in BVSD and in St. Brain. However, it does wane, and I know that before school ended, when these outbreaks started, right around prom season, most of the kids had been vaccinated.
And Boulder County has some of the highest rates. Vaccine rates in the state. That is because of partnerships with the school districts that we often don't talk about, but are happening behind the scenes.
Okay, any further questions on the director's report? Is that my job to ask that? Yeah.
Filling in for Lucy today. Did you say leads the Allorays program?
That is Janice Sticklich. I don't know if I'm pronouncing it correctly, but I will put it into the chat. And
Well, if
Allison,
it's public, I'll send you an email. Yeah.
and then Allison Bailey is the supervisor over the CSAP program. Yeah. Thanks. They're doing great work.
All the new business.
Just a reminder, board, the budget study session is Wednesday, August 21st. I believe at 4:30 p.m. I know it's in the afternoon. There will be refreshments. So expect dinner. Yep, here. And then our Board of Health meeting back on September 9th. Do you know the times of the October 30th for that? Ooh, yes. Okay. That's another thing too. I can also, as a reminder, on next Friday, we're having an August all staff. We invited all of you to prizes, food, refreshments, really great learning opportunities. I know Lindy, are you able to go? I can't remember. You said you can't join, but you're all invited. And then the October 30th is, let me get to that day on my calendar. The all staff that day, so that is including our Healthy Community Awards that Joe will be putting on. That starts at 9 a.m. and it goes until 4. So that's going to be at the Avalon. Terrible.
And the budget study session is from 4:30 to 6:30 on Wednesday, the 21st.
Yes. So nice.
Work.
May the force be with you. Yes.
Yeah.
Okay, all right. Next slide.
Next one.
Yeah.
You adjourn?
That'll do it.
Yeah.
Good job.
All right. Thanks everyone who joined
Thanks,
online.
everyone.
Thank you. Bye.
Bye, guys. Thank you.
Bye.
So that-
Thank you.